And I'm here to bring awareness to myocarditis, which is an inflammatory heart disease that came onto my son very quickly. My son was 21 years old. It was 4 months after his 21st birthday. He was healthy. He was an athlete. He was testing into the Men's Society. He worked. He went to school. He was the kind of kid that if he saw a woman carrying groceries, he'd run right over, pick them up, and carry them in. He was also very popular because he was an athlete and very well liked. He wrote computer programs in high school. He wrote poetry, and he was an artist. One day, after he went to work, he went to school, he was doing his exercise routine, and he slowed it down because he just didn't feel right. So he jumped rope instead of going through the entire routine. He stopped because he didn't feel right, went in and laid down. He was with his father. We've been divorced many years, and so he went into his father and he said, "Not feeling right." And my son Nino didn't complain about anything. So his father said, "What's wrong?" He says, "My heart's beating funny and it's a little hard to breathe." So his father put his hand on his chest and said his heart was racing, but he thought maybe Nino had pulled a muscle and that's why it was hard to breathe because he worked out so hard. But he said, "Let me just get it checked out." Took him to the ER. And within 15 minutes, they said that he was in heart attack mode. They had checked the elevated enzymes in his blood. So they brought a cardiologist in. His father was on the phone to me right away and told me, "You need to get up here." They said he's in heart attack mode. We're in the ER. They're prepping him for a catheterization. I got there, they were in the middle of the cath. I sat next to his father and asked him what was wrong, what happened. And he proceeded to tell me the story. Right after that, the cardiologist came directly to us, and he said his heart is at 10%.
Thanks, dude.
I've been consulting with some colleagues at the University of Pennsylvania because, quite frankly, any cardiologist would admit him here, and we don't have the tools. He won't make it through the weekend. It was Friday. It was actually midnight from Thursday into Friday, Good Friday. So the helicopter, do you need directions? So the helicopter came to get Nino. I called my husband, and my ex-husband followed me over. We got my husband, we went over to the hospital. They put us in a room while the heart transplant and heart failure team examined him. They came in and they said he's going to need life-saving surgery probably in the next 12 hours. We don't know what's causing it, but he's very sick and he may not make it. Well, Easter morning, they were going to install a VAD, which is a ventricular arterial device on the left side of his heart. It bypasses the heart and acts as the pump because the heart is no longer functioning. And when the heart doesn't function, your other organs start to go. Your liver, your kidneys, your whole system starts to die. So they're prepping him for surgery on Easter morning. And the surgeon says to my son, "Nino, I see here you're born the day after Christmas. It's Easter morning. And we're going to install a machine and give you life-saving surgery. What do you think about that?" My son said, "I think I'm being resurrected." And he made the doctor laugh, and they went through the surgery, and he came out of it. That was April 4th. April 8th, they took him back into surgery again and installed a right ventricular arterial device where he had the left one initially, because the entire heart was gone. They can't remove the heart because they had him at the top of the transplant list. And once you remove the heart, they're afraid the chest is going to cave in and they won't be able to implant a heart. On April 23rd, he had his third open heart, 19 days, because even with the life support, his body was failing. It was rejecting the machines. He was in surgery each one of those times between 7 and 9 hours for each surgery. April 20th, a heart came in. And we thought he was going to be fine. He was going to take the medicine. He was going to do well. He was going to be okay. First 6 months he did well. 6 months later, he started to have rejections. After multiple rejections, they started to question whether he was taking his meds correctly because they couldn't figure out why it took 6 months for him to start rejecting. Then on one of the biopsies, and for the biopsy they go through the carotid artery. You're awake. You just have a little lidocaine there. They go through your carotid artery, they go into your heart, and they take a piece. So when somebody's having multiple rejections and multiple issues and they have to repeatedly do this procedure, you build up a lot of scar tissue in the transplanted heart as well as in your neck. And it becomes more and more difficult to get a good biopsy. If you have something called humoral rejection, which is antibody mediated, you have to find the right part of the heart with the right cells to be able to determine that, because it's not through the entire heart. And you can't take the whole heart apart. So they repeatedly do biopsies over and over and over again. One of his rejections, they found humoral rejection. And that's when we started to spiral downward very quickly. Multiple humoral rejections, and then they found the giant cells in the transplanted heart. He had giant cell myocarditis. The thought was by giving him a heart transplantation, he would not get giant cell. We would just treat him as a heart transplant recipient and go through all the steps, and he would be okay. But when the giant cells returned, that wasn't the case. During this time, he had kidney failure as a result of the multiple heart failures. He was on life support, I can't tell you how many times, intubated. I can't tell you how many weekends they told us he wasn't going to make it through, how many days he wasn't going to make it through the day. But he kept fighting. And then he got to a point, he had nerve damage. From all the medications and all the surgeries, the nerve damage, he was in constant pain, very high levels of pain meds, very high levels of steroids. He couldn't sleep. He would cry out at night, "Please just let me sleep." He got sick April 1st, 2010. First set of symptoms, had his first surgery April 4th, 2010. He had 4 open hearts in 20 days. He spent the next 2 years and 9 months battling for his life. He passed the day after the Epiphany on January 7th, 2013, at home in a hospice bed. And there was nothing they could do. Some parents lose their children overnight. We were lucky enough to be near enough to a transplant facility where they had the equipment to diagnose. The treatment, unfortunately, is the lesser of two evils, but it's not a guarantee. And because he was young, he had a robust immune system, which in a normal person you would think that would be okay. But in somebody with giant cell myocarditis and heart transplantation, it's not. The stronger your immune system, the more medicines they have to give you to hurt your immune system, the sicker you become. We have to find some type of biomarker. We have to find some kind of early diagnostic treatments or diagnostic services, and then we have to find some kind of treatments that will actually treat the disease instead of just the symptoms.